I want to start firstly by saying we believe that a majority Conservative government will put abortion at risk in this country. Prime Minister Harper has tried to assure Canadian women that we have nothing to fear from a Conservative government. We are saying very clearly today that his actions speak louder than his words, and that we are raising the alarm that our right to choice on abortion will be in jeopardy if he is allowed to form the next government. Let's look at the Conservative Party record on abortion. Only a year ago, Stephen Harper, in spite of his protestations that he would not reopen the abortion debate, did just that. Harper's G8 maternal health initiative explicitly refused funding for abortions for women internationally, even though a Leger marketing poll showed that 61% of Canadians supported this. He ignored the advice of his own experts at CETA and went forward with this unpopular measure. Anti-abortion private members' bill have been regularly introduced by Conservative Party MPs. At least 2/3 of Harper's caucus is anti-choice, and if they won a majority, such bills could easily pass, even if not introduced by the government. After the 2006 election, Conservatives stopped the arbitration process, which would have enforced the Canada Health Act and allowed for the funding of clinic abortions in New Brunswick. Women have to pay out of pocket for abortions that should be covered by the provincial health plan and are essentially being denied access to abortion. Respected organizations such as International Planned Parenthood find their federal funding in jeopardy, with Conservative anti-abortion MPs taking credit. Over 20 other national women's groups which advocate for women's rights have also been defunded by this government, trying to silence women's voices. I want now to allow the other women with me here today to speak in more detail on this clear pattern of anti-abortion policies and initiatives taken by the Conservative Party in spite of what Stephen Harper has been saying. I would like first to have Angela Robertson speak.
Women's College Hospital has always advocated for choice when it comes to access to the full range of reproductive services women may require. We decried the federal government's position at the past G8 summit when they declared that they would not include abortion in their maternal and child policy for the developing countries. We decry today the administration's position, as stated by Conservative Party candidate Brad Trost, when he told a group that International Planned Parenthood Federation was denied Canadian funding because it supports abortion. As an institution with a proud history, 100-year history, and commitment to women's health and women's reproductive freedom, we believe this position puts abortion rights at risk for women in this country. In response to Trost's comment, Harper responded by stating that a Conservative government will never endorse anti-abortion legislation while he's in power. We ask, if these rights are worth preserving for women in this country, are they not equally worth supporting for other women around the world? And is it not worth ensuring that organizations working to support women's access to comprehensive health services are supported? While in government, Prime Minister Harper had remarked on the quote-unquote appalling mortality among mothers and small children in the third world, it is important to remember and acknowledge that lack of access to safe abortion contributes to that appalling reality and mortality. The 2009 United Nations report, Facts on Induced Abortion Worldwide, points out that approximately 70,000 women in the developing world die each year from unsafe abortions. A further 8 million suffer serious complications. The position of Harper's Conservative government on excluding women's right to abortion as part of reproductive health is one that is neither sound in public health terms nor compassionate and fair in providing full access to health care for women globally, and it creates a chill for women nationally. As an organization committed to women's equality, it is important to question any government or policy that would seek to curtail our reproductive rights here or abroad.
The facts are that over 500,000 maternal deaths occur every year. The facts are that 70,000 of them are due to unsafe abortions. Countless women who experience unsafe abortions continue to experience ongoing health problems such as infertility, chronic infection, hemorrhage, and uterine injury. The fact is that unsafe abortion has other effects on women: economic costs, stigmatization, psychosocial effects. The fact is that 1 million motherless children remain behind when maternal deaths occur. This is twice as dangerous for surviving children than the death of their fathers, as in most cases, women are the key breadwinners of the family. The fact is that in a lot of these countries, women have minimal, if any, rights. They are forced to endure things like child marriages and genital mutilation. In Afghanistan, 1 out of 5 women die in childbirth because they are too young. The fact is that 2 million young women between the ages of 4 and 12 endure genital mutilation annually. I'm sharing these facts with you because these are the facts that the Harper government ignores, and the decisions they make are made in ignorance of these facts.
I'd say probably in New Brunswick we are actually living the anti-choice agenda and have been for a number of years. New Brunswick continues to violate the Canada Health Act with impunity. The Medical Services Payment Act was created when Dr. Morgenthaler opened the Fredericton Clinic. It states that abortions may be done only with the referral of 2 doctors in a hospital by a gynecologist. So we have 2 hospitals that are doing procedures, but unfortunately we have many women without doctors. We have many women with anti-choice doctors. So for them to get a referral to get an abortion in this hospital is virtually impossible. So the alternative for them is that they come to our clinic and they have to pay. When the Conservatives took power in 2006, the arbitration process was put in place. The arbitration process that had been put in place by Assange was stopped. I'm not sure how far it would have gone, but at least the Liberals were making some movement in the right direction. We wrote a letter to Tony Clements, then Minister of Health, asking him about this arbitration process and whether it would continue. And Tony Clements wrote in a letter to us that it was off his radar. Obviously, it continues to be off the radar. The climate of shame and blame around issues of reproductive health in New Brunswick is pervasive. And I think there are probably a lot of even, and I perhaps shouldn't say this, but there are abortion providers in other parts of the country who are not even aware of what is going on in New Brunswick. So I'm very thankful for this opportunity to express my concerns and also a great concern of what a majority Conservative government could do to the limited services that we already have in New Brunswick.
Some of my work involves working with the Women's Centre, where we see a constant flow of women who come in looking for support, seeking referrals, and answers to questions about their own sexual health. Recently, I heard a story from a young woman who was very distraught because her friend back home in Windsor, Ontario, was trying to save up enough money to take a bus ride to Toronto to go to a clinic and get an abortion, because she didn't want to deal with the rumors and stigma that would spring up if she went to the only place that provided her with an abortion services in her town, which was the local hospital she was a volunteer at. This is the reality of many young women here in Canada. Although we have the right to choose in this country, we lack the resources to adequately support women and their sexual health needs. As a young Canadian woman, I am fearful of what a majority Conservative government would do to women's rights in this country. I am fearful that a majority Conservative government will only work to further erode, if not eliminate, access for women to sexual health information and services like abortion. I am fearful of the anti-women stances that our Harper Conservatives will continue to take. The Harper's Conservatives have already taken away funding from over 20 women's organizations that women in this country rely on to lead healthy lives. Despite Harper's recent comments not opening up the abortion debate, there is no question in my mind that if a Conservative majority were elected on May 2nd, my right and the rights of women across Canada to have control over our own bodies and reproductive rights would be in danger.
There have been 16 private members' bills, anti-abortion private members' bills, that have been brought forward since the pro-life caucus was established in 1998. In a recent one, Harper said that he would not support it, and he instructed his caucus not to support it, yet 87 of them did support it. It's a free vote, and he's been quoted as saying very clearly that he will not interfere with a free vote, saying it's all difficult, it's already quite difficult. And I think that if we're in a situation where 2/3 of a caucus is anti-choice, anti-abortion, a private member bill comes forward, and he may distance himself from it, but you still have enough in a majority government to have that pass. And so if his caucus is not, I don't want to say obeying, but taking his direction today on such a critical issue, this was a bill on coerced abortion supposedly, why would they do it in a majority where they're feeling even more empowered and have greater confidence than they do today because they're in power over the 5 years of a majority government? So this is what we're concerned about. It may not be brought into effect by Stephen Harper himself, but when you look at who he surrounds himself with, the Jason Kennys and others, and you look at the numbers, and we have them for you today, you can take them with you, of anti-choice members of his caucus, why would they not? They're an organized group that has been waiting to do something of this nature, and even taking that aside, all the other things that we talked about, the defunding of Planned Parenthood, the refusal to allow the arbitration process to go forward in New Brunswick, where women have to pay out of pocket for a procedure that should be available to everyone in this country. It goes on and on and on. The maternal health initiative. What would have made anyone, if they're not going to open the abortion debate, choose to firstly take out contraceptive, forced to put it in, and secondly, remove abortion when all the other G8 countries. Hillary Clinton made it very clear that the United States supports a full range of reproductive care, including abortion, and that's the way she felt it should be moving forward. It was only us among the G8, Canada, with a Conservative government, that made that decision, and that puts women's health and life at risk.